about the Prion disease. Prion disease comes from the two words PR and ION. ठीक है. PR मतलब proteinaceous infectious agent. Proteinaceous infectious agent. Actually, normal prion protein is PRPC and mutant prion protein is PRPSC. PRPC is normal, this is mutant. The difference between the two is mainly in the conformation. This is alpha helix and this is beta pleated sheet. The change in conformation of prion protein from alpha helix to beta pleated sheet lead to decrease in proteolysis of this PRPC, and this will accumulate in the different neurons PNS and CNS, and will lead to tissue necrosis and prion aggregation, lead to neurodegenerative disease caused by the prion protein. This is the structure of the normal prion protein. Normal prion protein having alpha helical structure, and this is the disease prion protein which is having the beta helix. Once from the PRPC protein, from any of the mechanism, once PRPSC is formed, then there will be spontaneous generation of PRPSC from PRPC, and accumulation of PRPC protein in the infective tissue occur. Now, prion protein can be inherited, they can be sporadic. They can be inherited from the parents, they can be sporadic, or they can be infective from other animals or human to human being. Okay. Most common type among them is sporadic, that is around 80% of cases. Now we will study about the prion disease in humans. Prion disease in human are of four types: Kuru disease, Creutzfeldt-Jakob disease, Gerstmann-Strauler-Schneeker syndrome, and fatal familial insomnia. First of all, Kuru disease. Kuru disease is transmitted from the ingestion of infected human brain tissue or from the other animal or from other animals. This is highly fatal disease. Next is Creutzfeldt-Jakob disease. Creutzfeldt-Jakob disease have further four types, that is sporadic type, familial type, iatrogenic type, and variant type. Most common is sporadic. Mode of transmission is unknown. Actually, there is somatic mutation and it will convert PRPC to PRPSC. Familial inherited is usually inherited in the form of autosomal dominant manner, and germline mutation in PRP gene is there. Iatrogenic from dural grafts, corneal grafts, or EEG electrodes. It can be transmitted from one person to another. Then is the variant CZD. Variant CZD is transmitted from other person. Variant CZD, why we have called it as variant? Because all other prion disease occur in old age. Why they occur in old age? Because prion protein having very long incubation period. They stay for years in the brain and don't do so much of inflammation. Why? Because they are proteins. Proteins are not so much of inflammatory. So there are no systemic sign and symptoms, and there is no fever. Patient is afebrile, though there is a infection, but there is no fever. But variant CZD, it is present in young male. Okay. And next, fatal familial insomnia. This is also a severe condition. This is also fatal, as the name is prescribing it. Now, how the prion protein causes neurodegeneration? By causing vacuoles in the brain. This is the histopathological examination in case of prion disease. There is spongiform degeneration. The word used is spongiform degeneration of the brain. Okay. But there is always an exception. The exception to this rule is two. That is, one is familial fatal insomnia and second is variant CJD. ठीक है, वेरिएंट सीजेडी में क्या होता है? In case of variant CJD, there are florid aggregates. There is no spongiform degeneration. There are florid aggregates. And also in familial fatal insomnia, there are aggregates. Now, how will the patient will present to you? Clinical features. Patient will present to you with myoclonus. Myoclonus of this disease is very specific. Myoclonus is persisting even after sleep. Persisting even after sleep. And also, this myoclonus is also known as startle myoclonus. Involuntary jerks are there. Okay, then other, actually there is a characteristic cortical involvement in this. So there is progressive cortical dementia in this patient. Progressive cortical dementia, myoclonus. Okay, and cerebellar ataxia. And cerebellar ataxia. Present with us. So the patient will present with us with myoclonus, which is persisting even after sleep. There is progressive cortical dementia and there is cerebellar ataxia. Okay. Then on examination, first of all the imaging, we will do the MRI. In MRI, as we are saying, this is very important diagram. This is showing the hyperintensity of gyrus. This is cortical ribbing. Characteristic of Prion disease. Characteristic of CJD. Second is reverse Hockey sign. This is reverse Hockey sign. Reverse Hockey sign. This is also characteristic of CJD and more specifically for variant CJD. Okay. The next investigation is EEG. EEG show biphasic or triphagic periodic burst. Then what about biopsy? Brain biopsy. Usually not indicated, obviously not indicated, because there is no treatment for the disease. So what will we do even after diagnosing the disease with the help of brain biopsy, which is the definitive diagnostic method? Okay, in brain biopsy we have already discussed there is spongiform degeneration of the brain. Spongiform degeneration of brain. This is 100% this disease is having 100% mortality. There is no treatment available for the disease. So thank you so much.